Charles. I'm the Executive Director of the Northwestern Buffett Institute for Global Affairs, and welcome back to our Northwestern Buffett Confronting COVID-19 Global Implications and Futures webinar series. The topic for this week is the global economic repercussions of COVID-19, particularly for vulnerable populations around the world, like displaced Syrian and Iraqi communities in Lebanon. And as we all know, those communities were already facing substantial challenges. So what are the economic prospects for them and for others at the periphery of the global economy? So to talk about this, I'm just delighted to welcome two truly remarkable individuals. First, my wonderful, inspiring colleague, Juliet Sorensen, a clinical professor of law at Northwestern Pritzker School of Law. Juliet teaches and studies international criminal law, corruption, health, and human rights. She's worked all around the world, and of course, among the many places she's worked is the Middle East. She is the director and founder of the Northwestern Access to Health Project, which is an interdisciplinary partnership that analyzes access to health in resource-limited settings. Now, Juliet is joined by her collaborator, Dr. Charles Benjamin, the president of the Near East Foundation. Charles has over 25 years of experience in international development with extensive experience in community development and natural resources management throughout the Middle East and Africa. And before joining the Near East Foundation in 2010, Dr. Benjamin was a professor of international environmental issues and development at Williams College and worked in international development consulting. He holds a PhD from the University of Michigan. So Juliet and Charles are going to speak together for about 30 minutes and then take our questions. And as you listen to Juliet and Charles, please post any questions you may have in the chat and to the right of the screen, and we'll assemble those and pose them to our panelists. So welcome, Juliet and Charles. Thank you so much for joining us today, and over to you.
Well, thank you so much, Annalise. It's really a pleasure to be here and to present as part of the Buffett webinar series with my longtime colleague and good friend, Charlie. I'm going to go ahead and share my screen, which has the slides that we will be referring to today. And as I do this, I'm just going to give, by way of background, the history of my own work with the Near East Foundation in general and Charlie Benjamin in particular. And I realized, Charlie, that later this year it will have been 25 years since I first met you and we began our work together. And it's work that I consider to be an iterative programmatic partnership at the intersection of human rights, global health, and development. I first worked with the Near East Foundation in rural Morocco, where I was a maternal and child health Peace Corps volunteer. And Charlie at that time was the country director for NEF Morocco, directing what was called the Appropriate Technology Center in the Anti-Atlas Mountains. Since coming to Northwestern, the Northwestern Access to Health Project, which is a global community-based interdisciplinary partnership leveraging Northwestern's resources of faculty and graduate programs in community partnerships around the world, has worked with the Near East Foundation in central Mali, in Sudan, and in Jordan, where our inaugural Schutte Global Fellow in Health and Human Rights spent a year working with Near East Foundation in Jordan, specifically with Iraqi women refugees, designing economic capacity building programs and accompanying curricula. Separately, because the focus of our talk today will be on Lebanon, I will note that the Northwestern Access to Health Project has worked with displaced Syrians in Lebanon for 3 years, and we're about to commence a collaboration with Near East Foundation in Lebanon, serving those communities. More on that later. Charlie, over to you.
Great, thanks very much, Juliet and Annalise, and it's a real pleasure and privilege to join you all. So I just wanted to, for my part, so Juliet and I are going to kind of tag team here on the slides and the talk, but from my side, what I'd like to do, so the Near East Foundation is an operational NGO. We have programs in 9 countries, focusing largely on the Middle East and North Africa, as will become clear. One of the major things that we do, a programmatic thrust, is supporting displaced people and their host communities. And we do this through small business creation. So we frame this as livelihoods recovery and resilience. And even, and as Annalise was alluding to, even without COVID, you know, the groups that we work with are extremely vulnerable. And what we're trying to do is really to help them achieve a basic level of economic independence. So what I'd like to do is first describe our work through the slides that are coming. I'm going to try to do it quickly, just to, and bear in mind that the slides are largely for the images that they present, just to give a sense of what these businesses, when I call them businesses, what they look like, and that's for context. And what I'd like to do is to look at our current efforts to understand the impacts, adaptations, and opportunities that are going to come out of responses to the COVID-19 pandemic in Lebanon in particular. So, Juliet, so keep going. No, if you could go back, if I should keep going with it. But I just wanted to say, if you could go back a slide, that a centerpiece of the work that we do are what we call Siraj Centers. These are community-driven livelihood hubs, and they provide services like business development training, vocational training, financial literacy, cash support, so startup grants, for example, social networking, and community outreach. In Jordan and Lebanon, between the 2 countries, we now have 7 of these centers operating, and also in Syria and Iraq, and I'll say a little bit about that. This is an image from Lebanon, just to give a sense of the scale here. So we've been working in Jordan. The Near East Foundation has been working in Jordan since 2013, and in Lebanon since 2015 on this specific initiative. And during this time, we have helped 24,000 refugees and vulnerable Lebanese and Jordanians access services through the Siraj Centers, mostly business development, but also some social protection work as well. I don't know if we've got the.
If you could just continue, well, hopefully she'll get back. She seems to be having a connectivity issue.
Okay, I'll do that. Juliet, if you go to the next slide, that would be great. So let me just say a little bit then about the work in Syria, which is inspired from the Siraj Center. We have now 6 Siraj Centers in Northeast Syria and 2 in Iraq. The image that will hopefully be coming up shows the interior of one of the Syrian Siraj Centers, which offers food processing facilities for women entrepreneurs. The work here, and this is the most recent impact economic data we have, working with farmers on productivity, we have helped increase their income by 51% in the past year. The processors were working with women, food processors, jams, dried food, and during that time, their revenue has increased by 160%. So this is where we're helping people start businesses, generate revenue, get their feet on the ground. In Iraq, we're largely dealing with returnees and internally displaced people, and the same for Syria. So just a couple more images. Here's another, an entrepreneur who we've helped in Lebanon. So through these centers, of the 25,000 people, almost 8,300 people have participated in training and received business development support between Jordan and Lebanon. Here's another example. an event planner, a wedding planner, event planner in Lebanon. So generally what we do is we bring people through a training program and help them prepare a business plan based on a market assessment, and then provide startup funding for them to launch their businesses. So of the 8,300 people, just over 7,000 people have received business grants, including this woman here. In Jordan, so a little bit about the impact of these, 72% of the surveyed business grantees report increased household income. So yeah.
Let me interject for just a moment.
Please, yes.
Ask if you could speak to the difference in conditions on the ground as experienced by displaced peoples in Jordan versus Lebanon, because I think that the differences are significant, but perhaps not obvious unless you've spent a considerable amount of time there.
Yeah, so what you have here, so most of the refugees, there are no official camps, refugee camps in Lebanon. There are 2 official camps in Jordan, but 85% of the refugees in Jordan live in urban settings. So they find, kind of these urban neighborhoods where they may find work and then seek refuge. They're not with limitations. There are some programs that allow Syrian refugees to work, but it's very restrictive. And what we find is there are certain sectors where the displaced groups are able to work. So when we work with, I mentioned we work with displaced people and their host communities, we work about 50-50. So in Jordan, we'd work with 50% Jordanians, poor, vulnerable Jordanians in these same neighborhoods that are hosting refugees, and 50% refugees. So what we're trying to do, and with reference to the person on the slide here, is help them develop some source of revenue that is independent from humanitarian assistance from the UN High Commission for Refugees, for example. These are registered refugees. They have restrictions on what they're able to do economically. We work closely with the government to figure out what's appropriate, what's allowable by law, and that's changed. It's a very dynamic situation. So the work that we started doing 4 years ago is very different than the work that we're doing now, and a lot of that has been in response to the regulatory environment.
Yeah, thank you. And I would add just a couple of points to that. First, because access to health is housed at the law school, the legal issues, both international and domestic, are interesting and complex. In Lebanon, Syrian displaced are not considered refugees because Lebanon actually never signed the United Nations Refugee Convention of 1956. Lebanon has instead entered into a series of MOUs with the United Nations in order to act essentially as an ad hoc host country. The domestic legal issues, a practicing lawyer would view them as compliance issues. For NGOs supporting Syrian displaced in Lebanon, for economic capacity building, supporting them in livelihoods, a prospective lawyer, and for that matter, a prospective investor looking to infuse capital into one of these initiatives might well ask if the social enterprise or the NGO is actually compliant with these restrictive conditions. There are differing degrees of enforcement, but nonetheless, it is challenging from a legal perspective.
Yeah, Juliet, that's a great point. There's a lot of so as an operational NGO working at the kind of grassroots community level, to have to grapple with a really dynamic and changing regulatory environment has been a real it's been a challenge. It's been a good challenge, but it's definitely part of our decision making as an NGO that we don't necessarily have when we're working with non-refugee populations. And again, it looks okay now. We're working in a formal system, but with some limitations even so. Juliet, if you want to go to the next slide, we can just move to just another image. But I think also worth mentioning that debt is a big part of the refugee experience. And these, Juliet, can you move to the next slide?
Of course. Sorry, let me go back to sharing my screen. And I need to catch up to you. Okay.
All right. Yeah. Next one. So based on our tracking of the impact of these small businesses, one of the things that we look at is debt. Understanding that particularly for refugee households, their household economy is not necessarily separated from their business economy. So it's trying to get people to manage separately is an important challenge. But it has, as you see, has had significant impact on reducing the debt load of refugees. This is a shot of one of the refugee business people in Lebanon, as a clothing shop, simple business. And I should say that as a matter of scale, we're talking, between $250, $300, $400 per month revenue from these businesses. It's a significant amount for these families, even if, from a purely economic perspective, financial perspective, they're not large. And then another piece of, you can imagine, under a displaced circumstance, trying to navigate the restrictions on people's economic activities, the social isolation that comes along with being a refugee. One of the things that we track is people's sense of agency, control over their decisions and their own well-being. And we've found that, particularly for women, that there's been a significant impact and increase in their sense of self-control over self. I tried to read the text above this shop. I think this is a little snack shop in Lebanon.
And Charlie, you and I were talking earlier about this, these efforts to quantify agency and self-confidence. Although Near East Foundation is not an advocacy organization, and the Northwestern Access to Health Project, housed and really approaching these issues from a rights-based perspective, does engage more in policy advocacy, even as it works on capacity building and sustainable development. The overlap, the common ground is the focus on agency, self-confidence, and indeed human dignity, which is at the core of all international human rights laws and standards.
Great, thanks, Juliet. So to bring things now to if you could go back to just a moment, Juliet, but to move to COVID-19. This is what we're dealing with. This is the experience that these folks who I'm showing in these slides are living right now. In most of the countries, almost all of the countries where we work, there has been lockdowns. They are locked down to different degrees. In some cases, and they're changing over time. Jordan had a very, very extreme lockdown, and the government had to loosen things up so that people could just buy food, for example. Lebanon likewise has had very strict lockdown. They have allowed certain essential businesses, particularly those in food and agriculture, to go on. Iraq and Morocco have both been locked down in a pretty severe way. Northeast Syria, Sudan, partially restricted, and the exception now is Mali, with other country where we have an office that is really just starting to see their cases take off. I was on the phone with our country representative there, who's a Malian, who said that people are just now starting to really get concerned about what's going on. So for me, there are two aspects to the adaptation that I've seen and been part of since these COVID-19 lockdowns. One is that we've been forced to find new ways of doing our work. Our work involves direct interaction with these folks. We have teams in the field, provide training, do follow-up coaching of their businesses. What it's seen for me, I've always been a skeptic of e-learning, but I've seen that our teams have really taken these technologies and done creative, impactful things with it. So the first experience was an initiative of our Syria team, and there are some restrictions in Syria. Our Siraj Centers are temporarily they're not closed, but they're not receiving visitors. But they did an entire training curriculum on health standards, food processors using WhatsApp video training. I had a hard time, frankly, understanding how exactly they did it. It took a while. Zoom, local platforms for doing things like this, WebEx, and then phone calls. We've been put we're now developing a common platform for e-learning that will go across these countries, and it's adapted for different levels of technologies in each place. So it's forcing us as an organization to think about using technology in new ways, overcoming the resistance of someone like me who wants to be in the ditches with folks. Then the other aspect of this is understanding the experience of the quote unquote beneficiaries of our work, our local participants and partners. And so we a couple weeks ago launched what we're calling a global COVID-19 assessment, global in our world, but we're looking at the impacts of COVID-19 on these businesses, how people are adapting, and what types of opportunities they see coming out of this. So the next three slides are some very preliminary. They focus on Lebanon, very preliminary data from these surveys.
Charles, before we share the results, I actually a question for you, but also a comment. First, your description of your teams in the field as being highly adaptable and deft. It was COVID obviously was not something that was anticipated. Indeed, it's unprecedented. Near East Foundation is nearly 100 years old. You've encountered a lot of challenges, but nothing quite like this. So I'm interested to hear how Near East Foundation's policy has varied country to country. Are you taking a centralized approach with regard to directives to your teams in the field, or does it depend on the policies and situation in each place?
Yeah, well, that's a great question, and we do have some common guidelines, and these are early in the crisis we shared with our teams the basics: the washing hands, the social distancing, the option for remote work. These are all things that we've people on the call can see I'm working from home in my guest bedroom right here. Everyone's in that situation. We also say follow what the government says. So if the government says, stay put, don't come to work, which was the case in Lebanon, that's our policy. In some cases, the government will allow certain types of activities to continue if we petition the right way. And that has been the case, for example, in Syria, where we're conducting training remotely, but we'll actually go and deliver cash grants for business people in person. And we're developing standard operating procedures for Syria for cash disbursement, just like we're at the same point in Lebanon. We've gone through a cohort of trainees. They've submitted business plans. We're hoping to get them startup grants in spite of the lockdown. So those are all things that take a little bit of special accommodation.
Thank you. So I'll speak for just a moment to the collaboration that we're about to commence with Near East Foundation Lebanon. So you've described the economic capacity building in the Siraj Centers. Lebanon prior to COVID had entered into an economic downturn that was making it even more challenging for marginalized communities, including not only Syrians, but also low-income Lebanese, as well as the Palestinians who live in Lebanon, to be gainfully employed. So our collaboration with NEF is going to focus on entrepreneurship, both the legal and the business aspects of it. It will focus on the law school in Kellogg in terms of human resources at Northwestern, not only in light of the economic downturn, but also in light of COVID. Prior to the pandemic, some Syrian displaced had begun to return slowly and in fits and starts back to Syria from Lebanon. Our anticipation is that one aspect of the curriculum will reflect how to transition your business successfully upon returning home. There's no question that there are very dynamic conditions on the ground. The other issue that Human Rights Watch has reported out of Lebanon is that in the lockdown, Syrians are being treated differently from Lebanese, with no public health related justification, which possibly raises the possibility of discrimination and stigma. So it's a collaboration we look forward to commencing, albeit in challenging times.
We're looking forward to it. It's always been good, Juliet. So if I may now, these are just some of the results, and please review these not as, or look at these not as I'm among academics here. Please don't look at this as a rigorous academic study. It was a multi-country effort to ask a limited sample, a limited number of questions. So it was semi-structured. So this is really the interpretation of these discussions. I would like to say, Juliet, you asked about our teams. I believe that there are some members of the Near East Foundation team, and I think the Near East Foundation Lebanon team who are listening in. So I just want to give credit to them that they organized this very quickly under very challenging circumstances to get in touch with people and really try to understand this. All of the data analysis and presentation here is the product of their efforts. So I want to recognize that. In Lebanon, we spoke with 60 people, 20 people from 3 different communities. There's a equal representation, male, female, Syrian, Lebanese in here. And this is the first, so I mentioned 3 really simple questions that we asked. What's been the impact on your business? How have you adapted, and what opportunities you've seen? So without going through all of these, just to give a sense of the range of issues that people are identifying as affecting their businesses, 97% of people said that the COVID-19 pandemic had a negative impact on their business. And then we get into the reasons for this, the lockdown, so limitations that are imposed. There are also challenges in local supply chains to get product from one person to another and get to market. And then there's I think an interesting 15% of people who say that the products and services that are offered by their businesses were not a current priority to the community. And this the examples that we have are hairdressing, makeup, satellite and cell phone repair, and tourism. So I think that's an interesting thing to look in a little bit, looking at how, I mean, it all makes sense, and we're experiencing the same things here, essential, non-essential. You could break it down like that. But that's what it looks like in these 3 urban communities in Lebanon. All right, Juliet, if you want to say something to that, otherwise we can go to the next.
No, I'm all set, Charlie. Thank you.
Super. So this is, we like to think of our work as bringing out people's entrepreneurial spirit. It's not just managing a business, but looking at need and responding through business to these needs. The responses here are a little bit mixed between what precautions people are taking to in their operations to limit the spread of COVID or possible transmission of COVID. The other are responses they've taken in adapting businesses. So they range from using and 31% of people are using the full spectrum of responses: face masks, gloves, sanitation of all products. Another 21% are changing the way they're doing businesses. So home delivery of groceries is a good example of that. And then 15% of people have actually changed the types of products and services that they provide: sanitation services, food, and sanitation equipment. So some people are managing the COVID response in different ways.
Charlie, since the onslaught of COVID, has Near East Foundation been coordinating at all with direct service providers in terms of the provision of PPE and some of the other things that are described here?
No. Well, not in Lebanon. I don't think. I think that and I don't want to say this with 100% certainty that some of the tailors are making face masks. I know that some of our Moroccan entrepreneur partners have those that are manufacturing and are manufacturing now mainly masks. I don't know about plastic shields or gloves, but and I think that some people are starting to sell those, or they couldn't give any in Lebanon, at least part of the supply chain, if not manufacturing. But I'm pretty sure that some of these types of products are being sold, and PPE is not I don't know about that, but sanitation, Clorox, that type of stuff. So next, this is the last slide here for these results. And I should say that we're in the process right now of analyzing and collating and preparing a report here. We hope to have done by, I think we've looked toward the end of next week for that to be ready. So, and the last, again, this goes back to entrepreneurship and looking at the world through an entrepreneurial lens, looking at what types of opportunities our local partners see as they come out of the the COVID-related lockdowns. A large percentage of them don't see any opportunity. They're biding their time. They've adapted their practices, but they're waiting for this to be done. And for the what most people said was it was having a negative impact on their businesses. Government restrictions on mobility would start to ease up a little bit. So they're biding time. However, there are 18%, a huge number, but significant in this way, who do see this as an opportunity. These are the people who are adapting to changes in the marketplace, either in the way that they operate their business, for example, deliveries, or products and services that they will expand into in the future. Of note, some of the people who we spoke with, 3 1/3%, really were facing mental health issues in their mind, so we're in need of psychosocial support. There are organizations that are handling work specifically with refugees. So, but again, access has been limited because of mobility issues. Juliet, you asked about coordination with other service providers. I think I focused on the supply chain aspect of things. We do, in fact, have a referral system, so that the organizations who are working in the same service shed as we are know what we're doing. We know what they can do, that they're doing, and we do refer people. And this is through a kind of a social protection lens refer them to the right service providers. This is our small piece of helping people improve their lives, focusing on business and economic self-sufficiency. But we don't want to try to do everything, but we do want to work with people who are doing other things that are as important. So what we're trying to do is to help people see opportunity, embrace opportunity through entrepreneurship. And if I could, just one last thing that I'd like to say, Juliet, is that I look at what's happening right now, and I don't know how long this is going to go on, but I think we're going to be in a position in many of these small communities in Lebanon, Jordan, Syria, Iraq, Sudan, and other places of really rebuilding these local economies from scratch. Markets are disappearing, people's capital is disappearing. As you mentioned, Juliet, there's a financial crisis in Lebanon where inflation, the people's money, Lebanese lira, becoming less and less. The purchasing power is going down. So I think that as we look forward, figuring out where do you start? The government's going to play an important role. Municipal governments are going to play an important role. Access to resources, sustainable mechanisms for restarting businesses. We're going to be in a position where you've got people who are talented, skillful, good business savvy, good business managers who just need to figure out how to get their feet back on the ground. And that may be simply a matter of getting them access to capital.
So a couple of points to follow up on that, Charlie. First, as you've noted, when a lockdown is enforced, the trade-off, of course, is that people are deprived of their income. We see that here in the United States with pressure to reopen, which appears to contravene the interests of the public health. But economic self-interest is strong and growing, sometimes I feel, to the point of desperation at home and around the world. I think that one of the challenges of this epidemic is that it has caused each of us to look inward. And so my final question to you before we wrap it up and open it up to questions from the group is, you speak about challenges and opportunities in the communities that you work with. I'm curious what you see as challenges and opportunities for the Near East Foundation. The Near East Foundation has worked in the area of global development and humanitarian services for so long. Many of your financial resources come from governments, both the United States and European governments and the EU. I assume your funders have shifted their own focuses. Has that been challenging for NEF? What do you see for global development in that way?
That's a good question. That's tricky. Tricky to respond to. When this first hit, all of you play out the worst case scenario, and I saw, catastrophe in the making. As you said, a lot of our funding comes from U.S. and foreign governments. We fund a certain percentage of our operations through indirect cost recovery. So if we don't spend the money doing our work, there are other impacts on our headquarters staff, for example, regional functions, some in-country functions. But what I would say is that it's been a challenge. It's been a good stress test, if you want to look at it that way, that we've had to focus on three things, really. One is keeping things going to the best we can. And I don't think it was clear at the beginning what that was going to look like, right? But our teams in the field have just been really inspirational to me in trying to figure out how to keep things going, serve the communities we serve, follow the mission that drives them, and found ways of doing things and been really good problem solvers. So keeping things going, managing the finances. We've had to go through some cost cutting for sure. We haven't had any layoffs, And I should note that we did receive one of the SBA small payroll protection program forgivable loans. That was really helpful. I think I would say critical for us to maintain the capacity that we have. And then the other piece of this for me is thinking about, okay, managing through the crisis is one thing. How do we position ourselves to respond once things start to return to normal? And that I've seen as both how we do business and how our local partners do business, what opportunities and how they're going to adapt. So we've been taking some of the slowdown in implementation to the extent that there has been slowdown and focusing on learning, analysis of, kind of the impacts of our work. We've got a whole initiative focusing on that, and then figuring out how do we take take the things we learned out of this crisis and come out of this a stronger organization. So it's like in ecology, one of these cycles of creative destruction where you build up energy, something comes, whoosh, makes you have to rethink things, and you build back better.
Well, I hope we can build back better. I'm going to stop sharing my screen, and I believe we're going to segue into taking your questions.
Great. Can you hear me? Hello? Yeah.
Yes.
Yeah.
Okay, great. Well, thank you both so much. Very, very interesting. Lots to talk about. Maybe if we could, I'd love to ask you, Charles, to go back to the super concrete with us. I'm a person who studies markets, so I was really interested in what you said about the sort of nitty gritty of how these people, how the household economy works. And you mentioned that debt is a big challenge. Can you tell us a little bit about how household debt is being impacted by the COVID crisis, and what tools or opportunities do refugees in Lebanon have when debt gets out of control? Who do they borrow from? Where do they get their money to cover those debts? Look, we can't hear you. There.
Okay, thank you, thank you. That is saying that's a hard question, and I wish I have documents in front of me that would, that we've developed that have some of the contours of debt. So I can't speak to that so much. I will say that there are some people. So a couple of things: debt and household economies. There are cases where, when we start this process with what we call a vulnerability assessment. And this is, it's based on UNHCR tools. We adapt them for context and also to identify people with certain types of vulnerabilities. So one of the things I was blown away by initially when our team started doing these vulnerability assessments. There are people who have zero income in these communities, refugees who have zero. They rely on their neighbors for everything, and I think that if you look at the way that things go, and I'm speaking out of my real area of knowledge and comfort here, but let me go there anyway. There are, first of all, there are some people who come to, I'll say Jordan. I have a clear case that I'm thinking of. No, this is Lebanon, sorry, who came from Aleppo with a mortgage that she had to pay off for a restaurant that was destroyed by a missile. So she had debt, but no asset associated with that. She was in Lebanon. Her main concern was paying off that loan in Aleppo so that she would be left financially whole. I think that and this is, again, I'm going to speak, I'm not sure about this, and I'm sure that there are people listening who have more and better information than I do. I think that there's credit at stores. There's credit to landlords, so people get behind in paying rent. All kinds of things like this. I think probably debt to neighbors and family. I hear a lot about family, borrowing from family members. so those kinds of things are not, there's no microfinance institution that a refugee can go to take out a loan to pay off this kind of debt, which is why it's such a huge issue for people. And when I remember when we started talking with people, their concern was as much about managing debt as it was about surviving day to day. The two went hand in hand. Anyway, yeah.
Go ahead.
No, that's about all I think I can offer there.
And another thing that you mentioned about the economy that was fascinating was the importance of cash, and the fact that your organization can do a lot of things virtually, but at the end of the day, it has to deliver cash physically. Can you tell us anything about how the COVID crisis is impacting the cash economy? I mean, I know in Korea, they've been disinfecting cash itself. Some economies have talked about, some countries have faced challenges just with the liquidity of cash. How does the fact that these people rely on cash make their experience of this crisis different, do you think?
Yeah, so I can't speak to the experience of, say, a shop owner and the exchange of cash right there. I do know that it's been, in Lebanon, it's been very difficult for people to access cash at all. And my sense is that people are either not paying and accumulating what they see as a short-term debt until they can get the money out of the bank. Or they just don't pay, or they do without, right? Because they can't have cash. For us, delivering cash, so in Lebanon, for example, we go through the Lebanon Post, the post office, and we use debit cards. That's how we provide our startup grants to teams. In Syria, it's cash dollars that are taken, in a bag, from Iraq to northeast Syria, and people are paid in kind. So this is where or not in kind, sorry, they're paid in cash dollars, dollar bills, they're dollar bills. So that has, with the banking system, banks were closed in Iraq. There's no banking system in northeast Syria. We had to go through a lot of workarounds, and our operational team did a lot of negotiations to find the right person who could, and group who could cross a border that was still open with money that they could get out of a functioning banking system. So in a lot of, this is the situation is posing as many operational challenges as it is economic and health, really, in a way. So
I think that, Charlie, in that way, NEF is strengthened by its model of permanent local staff, because your teams in the field are going to be more knowledgeable about the ways to maximize, last mile delivery and efficiency in those ways than, with respect to yourself in New York, or somebody who doesn't have that deep lived experience as part of a community.
Right. Well, I will say that in this particular case, the movement of cash from Iraq to Syria, of course, it's a team, but a lot of this is beyond the kind of scope of daily experience and knowledge of the folks who are NEF in the field. For example, complying with OFAC, and getting someone who can actually move cash in that setting, who will pass vetting from the U.S. government and others. So there are a lot of people involved. It's a truly kind of international, you're right. Compliance is about law, it's about negotiations, and it's tough. But I think that for me, I feel that it's the right combination of having permanent local staff with great local knowledge and tacit knowledge of their operating environment, and an international staff who can help navigate the really international and compliance-oriented aspects that are more related U.S. laws than they are Iraqi or Syrian laws.
Interesting.
And to align the three sets of so.
So I want to talk about the law questions in just a minute, but we have one more question from the audience on this specific topic about money. One of our participants asks about smartphone technology and cellular platforms and whether those are as prevalent as they are, say, in Africa, and whether they're a tool for doing your work.
So I think it depends on where we're talking about, and honestly, Brent, I don't know in Lebanon and Jordan how prevalent mobile money is, for example. We've never had to worry about it, but we do use debit cards. So there are measures in place to protect against certain types of issues. However, we've actually been talking about it with respect to Northeast Syria, where there's not a functioning banking system. So, and I think that there are groups who have piloted these. We just had a conversation about it a couple days ago, in fact, last Friday, about looking at different experiences, because we will soon be in a place moving more money in more diverse ways to people, and frankly, with things like they are right now, it seems like it would be more feasible if you could find a way of using mobile money to do grant making and then expense management.
Thank you. Now, maybe shifting to the bigger picture, Juliet, you're really an expert in international human rights law, international law more generally. When you look now at the international human rights regime, whether it's international law, international institutions, both from the perspective of the law and what you've seen on the ground, what do you see as the biggest gaps in that regime, that toolkit for thinking about something like the COVID crisis?
Annalee, there are so many tensions between a whole range of procedural protections, civil liberties, and rights, really from local to global. Here in the United States, and indeed in much of the world, although the power to impose regulations related to public health made its way up to the Supreme Court 115 years ago, and here in the United States, it deems part of the police power of the executive branch. It's rooted in the Constitution. The fact of the matter is that we haven't had to deal with a global pandemic that has hit home for us since the Spanish flu. And so we have indeed, I've seen various analogies used. The muscle has become weak, it's become dusty. For a myriad of reasons, rights centered around individual liberties are, 9 times out of 10, for good reason, going to win the day from a rights-based perspective. And the easiest example, since you mentioned international tribunals, let's take international criminal tribunals. You have an incredibly important issue at stake, which is one individual's liberty. And in the instance of international atrocity crimes, it's liberty that could be deprived from that person for a very, very long time, decades or effectively life. But now you're confronted with a situation where the need for that person's liberty interest to be adjudicated runs squarely in conflict with public health restraints that are applied the world over. Whether it's opposing counsel, judge, depending on the nature of the proceeding, the jury, and so that individual's right to due process, including right to a speedy trial, has in most parts of the world been suspended in the name of the public health. And I think actually the most of those decisions are going to be held up on review, again, at home and around the world. What is missing, I would say, is a contemporary interlocking network of regulations that respect the panoply of human rights, including, by the way, access to health care, and recognize that extenuating circumstances call for some powers to be promoted above others. The WHO, as you know, has long been underfunded and marginalized. The United States has apparently decided that now is not the time to lend its support. I would argue that the WHO needs to take center stage and remember why it came into being many decades ago, along with, frankly, other UN bodies. So I could go on, but I'll stop there.
So you think there's a need for more international institutions focused more specifically on health, or the sort of beefing up of the ones that we have, that international institutions have an important role to play here, not just government-to-government relations?
I think it's time for the term international community to be more than just a term. I'll give one other example. I'm a member of the American Bar Association Task Force on COVID-19. Up until now, the ABA has done zero coordination with peer bar associations around the world. And yet, to state the obvious, the pandemic knows no boundaries. This task force has the opportunity to be impactful. It could be exponentially more so if it saw itself as one professional association that's part of a unified constellation.
Since you mentioned health, Juliet, we have a couple of questions about the refugee committees that Charles, you've been talking about around their access to health care. What kind of support are they receiving right now for their health care needs around COVID? Who's providing that? How adequate is it?
Excuse me, can I punt this to Juliet? Because I think that she has a better understanding than I do of the health system. I do know that it's been in flux in terms of the last I looked in terms of who gets free access, who has to pay, what are the conditions of access to local clinics. But Juliet, can you answer that?
Well, Charlie, in Lebanon, if a Syrian displaced person is registered with the UNHCR in Lebanon, that entitles them to access to primary health care. What I can't speak to in Lebanon is the availability of testing, whether that's available at primary health care centers and whether that's available at primary health care centers that treat Syrian displaced. I know that Lebanon has quite a robust free press and that uses digital platforms to report and expose issues internationally. Limited access to both diagnosis and treatment are one of the areas of concern that has been raised about Syrian refugees in Lebanon since the onset of the pandemic.
Very interesting. Well, we'd love to hear more from you about that and keep in touch about this particular issue. Unfortunately, we have to stop, but we really appreciate both, obviously, the work that you're both doing and your willingness to come here and take the time out to share it with us today. Thank you both so much, and thank you also to everyone who joined this webinar. Next week, next Tuesday, same time, May 5th, we'll be hosting social psychologist and Northwestern Kellogg School of Management professor Dr. Adam Waite, who's going to be discussing individualism and social disengagement in this crisis. So that should be interesting. So please tune back in for that. And until then, thank you for all you do. Be well and stay healthy, everyone. Thanks so much. Bye.
Thank you very much.
Bye. Thank you.